And I want you to tell everyone here about the opportunities in the digital interface between mental health and the work that digital technology has in your life.
Just for a little bit of background, so I'm the chief of psychology at Mass General Hospital. That's what Martin meant when he said I work in a field that has great needs. So as you probably know, most people who suffer from mental health issues are currently not getting any care at all. That's the norm. And those who do typically don't get good care. If you're waiting for care, the wait lists tend to be very long simply because we don't have enough providers at the moment. And if you find care, it's often very, very expensive, or people will say it doesn't fit into their lives. And then we have the issue with stigma, which you also touched on as well. For many people, it's just too much to walk into a place like Mass General or so and to be seen by others. So that's why I think there are just great opportunities in mental health if you're so inclined because of the massive provider shortage that we have. And of course, what we have been doing and what I would encourage many of you to also think about is you want to reach people where they're at. So what we have been working on at Mass General in collaboration with some companies is try to put tool on patients' own devices. So, if you can reach them via a smartphone app or an AI-powered bot or so, you can reach them wherever they are, whenever they might need help. But I want to get back a little bit to something, Martin, because I know we are short on time, and I think it's important for those developers out there. I want to get back to something that has come up earlier. So people like us here often partner with people like you, right? And what we have said earlier, and you made that very clear, what we are all looking for as we are looking for company or industry partners is that we want people who are really thinking about, okay, how does this fit into our workflows? How will the providers like it? How will the patients like it? That's extremely important. But the other things that I would also encourage you to think about, at least how I think about it when we are selecting a company to work with or when we are selecting a tool to buy, would be, what's the evidence of this tool? Is this, whatever you're building, is this somehow grounded in science? Do you have any, at least pilot data to support what you're looking for? Or if not, are you planning to get those pilot data?